Physical therapist or chiropractor? What's the difference? Which one should you choose? And which one makes the most money? There are many similarities, so I'll start with those. Both are trained at a doctoral level and get their clinical doctorates. They both also have to pass a national board exam to be licensed. Physical therapy school, depending on the school, takes 2 to 3 years, and from what I found, depending on the chiropractic school, it takes 3 to 4 years. And those times mentioned were the length of graduate schools after traditional college or undergrad. PTs and chiros both help improve function and movement before and or after an injury using non-surgical techniques or without the use of injections. They both prescribe exercises to improve range of motion, increase strength, and to help the person just get back to their activities of daily living or whatever their goals are. In my opinion, the big differences between PT and chiro come in with the history, the settings of where they both work, and the specialties. From what I researched, the history of chiropractic started with Daniel Palmer, who reportedly did the first manipulation and started the first school of chiropractic medicine. With physical therapy, the history started with 2 big events from what I researched, poliomyelitis and World War I. And in World War I, physiotherapists or physical therapists were called reconstruction aides. Now with settings, physical therapists can work in many different settings, and I'll put some of those right here. And with chiropractors, I'm sure they can work in many different settings. I'm just not familiar with all of those, but traditionally you'll see chiropractors in their own outpatient office. Another big difference that might be changing into a similarity is imaging or radiology. Chiropractors in most, if not all states, can order imaging for their patients. However, in the past, only military physical therapists can order imaging, but recently only a select number of states have put in legislation where physical therapists can order imaging. With specialties, the biggest differences I've seen according to the ACA with chiros and the ABPTS with physical therapists are as follows. There are more differences, I'm just going to name off the ones that stood out to me. With PT, the biggest differences I saw with certifications or specialties was women's health, electrophysiology, and cardiopulmonary. Now, how much do they make? Just keep in mind, like many health professions, these salary ranges can range from low to high depending on many different factors. So don't get stuck or bent out of shape on a number I say. For chiros, according to healthjob.org, what I found is $75,000 is the average. And for physical therapists, according to UpDoc Media, the average can range from $83,000 to $87,000 a year. If you learned something, give us a follow.